Now that we've talked about birth and the newborn, we will be starting Unit 3, where we will discuss the development of infants. Infancy is a period of development that lasts from the birth of a newborn to the age of 2, so infancy through toddlerhood. During the first 2 years of life, the changes that take place physically and cognitively and socially and emotionally are so dramatic and so noticeable. So first, we're going to focus on physical development. The average newborn weighs approximately 7.5 pounds and is approximately 20 inches in length. The first few days of life, infants will lose about 5% of their body weight as they are eliminating waste and they're getting used to feeding, but typically this is only temporary. By the age of 4 months, their weight typically will double. By 1 year, their weight triples, and by age 2, their weight quadruples. The average length at 1 year is about 26 to 32 inches. Another dramatic physical change that takes place in infancy are the changes in body proportions. Half of the body area of a 2-month-old fetus is devoted to the head and brain, as you can see in the picture. At birth, the head measures 1/4 of the body's length, giving the infant its characteristic baby look. As you can imagine, this is also why it is so difficult for an infant to raise their head, in addition to weak neck muscles. Some of the most dramatic physical changes take place in the brain. At birth, an infant's brain is 25% of an adult weight of an adult's brain, the weight of an adult's brain. By the age of 2, the child or the toddler's brain is 75% of an adult's brain. By the age of 6, 95%, and by the age of 7, it has reached 100% in terms of the weight and how it compares to that of an adult brain. So you can see that brain development is extremely critical and it happens very dramatically in infancy. Children are born with about 100 to 200 billion neurons. These are present at birth, as I mentioned. However, they're not fully mature. During infancy, there is a natural process that takes place in the brain called synaptic pruning. And as you can see in this chart, you can see the connections, the neural pathways that are existent at birth, again at 1 month, 3 months, 15 months, and 24 months. You can see by 2 years old, at the end of the infant period of development, you can see how much more intricate and elaborate the neural pathways are in the brain. What takes place during infancy, as I mentioned, is a process called synaptic pruning. During this process, neural pathways that are not being used are eliminated, and the ones that are being used are strengthened. And one of the major contributors of this process is experience. Experience truly determines what neurons stay and which neurons are eliminated. And so the stimulation that an infant is provided with and the nurturing will really determine how brain development unfolds. Another major change that is happening in the central nervous system is the development of myelin. Myelin is a coating of fatty tissue that surrounds the axons of neurons. And myelin is formed or created by glial cells, which is another type of cell that exists in the central nervous system. Myelin insulates the axon and it increases the speed of transmission of neural impulses. This actually enhances the building of neural pathways in the brain of an infant. When myelin is formed and coats the axons of neurons, we see an increase in the ability to coordinate and control their movements and also their thought processes. So the increases that you see in development in infancy, such as their ability to start moving more sophisticatedly, to understand certain things, to develop language, all of those more sophisticated processes are because of brain development and because of that myelination of the axons of neurons in the brain. As we are discussing brain development in infancy, it's really important to discuss and learn about shaken baby syndrome. Shaken baby syndrome is an injury to a baby that is caused by being shaken violently and repeatedly. This violent act of child abuse can cause swelling in the brain, it can cause internal bleeding, and it can also cause the retinas of the eyes to detach, leading to blindness, could lead to a variety of intellectual disabilities, and it can even lead to death. So let's watch this video that tells us a little bit more about the impact of shaken baby syndrome and how it can be prevented.
You and I have seen this, and it's absolutely devastating. It's so hard to believe, but sometimes caregivers or unfit parents actually hurt their child out of frustration and anger.
You and I have seen this, and it's absolutely devastating. It's so hard to believe, but sometimes caregivers or unfit parents actually hurt their child out of frustration and anger.
A 3-month-old baby who may have been violently shaken appears to have permanent brain damage and may go blind.
1,400 shaken baby deaths every year in the U.S.
If we see little blood spots all over, that's usually retinal hemorrhages.
Shut up, be quiet.
The baby had bleeding in her brain and eyes. Police are investigating the father for child abuse.
Usually if the middle part of the brain is damaged, the baby will die.
So you and I, we've seen this.
And it is, yeah, we see it in the ERs, and they come in, and parents, they just lose their cool, and it's just, it's terrible that this happens.
And literally, it can take one shake,
Yeah.
and a baby can suffer
Serious brain damage.
Serious
And
brain
this
damage.
simulator can show you how that brain damage can happen. Okay, this baby starts to cry as the caregiver. If you don't keep your cool, you start to lose your frustration. And with a bit of forceful shaking, you can see the back of the brain starts to light up. That indicates a baby that's shaken like that will probably have visual problems because this part of the brain controls vision. And the shaking continues, the front part of the brain lights up, and a baby there would have behavior problems, developmental problems, things like that. Basically, the baby's head is accelerating, decelerating in that figure 8 motion, and that really produces a lot of force. And what happens in the brain when this happens is you get different parts of the brain move in opposite directions. You get a shearing force, which can tear the neurons, the cells in the brain. And that actually can also tear small blood vessels, which then lead to bleeding, which is very, very serious.
the eyes.
The eyes, from all those shearing forces, the back and forth motion causes the lining of the eye, the retina, to kind of separate from the back. And some of those small blood vessels tear and could cause what's called a retinal hemorrhage. And that's a huge sign of child abuse. I wish this is something we would never see, but unfortunately it's...
Yeah, there's no worse call for a pediatrician or an ER doctor to make than to Child Protective Services, or worse yet, after a death from a shaken baby or other trauma. So that's very heavy stuff. We know this, but I want everyone to listen to Jim, because we're going to talk about ways to deal with a crying baby that are much more constructive, ways to prevent yourself from getting so frustrated.
I have 4 tips to soothe a crying baby. I call them the 4 S's.
4 S's.
And it's not it's a different S word than we usually thinking. But first S is swaddling. Simply just swaddling a baby can sometimes simulate the womb and make them happier. The second one, a shushing sound. Get them snuggled up and go shh. That's this calming sound. It kind of also simulates what the mom's heartbeat in the womb. The third one.
Infants are born with numerous reflexes. Reflexes are involuntary movements in response to stimulation. Reflexes are automatic. Some reflexes include the sucking reflex, as you can see in here. The rooting reflex, which is if you touch the cheek of an infant, they will turn their head in that direction. The palmar grasp, which is also a reflex where if you put your finger in the palm of an infant, they will grasp onto your fingers. So those are just a couple of the numerous reflexes that infants are born with. And what these reflexes tell us about development is that their neurological systems are functioning. The first several weeks of life, what happens is that these reflexes are then replaced with voluntary movements or motor skills. Speaking of motor skills, the first type of motor skills to develop are gross motor skills. So gross motor skills are voluntary movements that involve the use of larger muscle groups, such as the arms, the legs, the head, and the torso. And through this chart that you're seeing right now, you can see how typical gross motor development unfolds. Fine motor skills are another type of motor skill that develops throughout infancy. Fine motor skills are more exact movements of the hands and the fingers, and they include the ability to be able to reach and to grab an object. However, this takes place over the infant period of development. Very early on in the first couple months, infants are preoccupied with their own bodies, so they may start noticing their foot, as you see in the picture, or they might be using some of those reflexes like the palmar grasp initially. It isn't until about 9 months, give or take, where the infant begins to be able to have use of their thumb, and that just opens up the world for infants. And once you can use that thumb, they start to really become interested in manipulating objects and just really exploring all that they can do in terms of fine motor skills. Nutrition in infancy is extremely important. Breast milk is considered the ideal diet or nutrition for newborns. It has the right amount of calories, the right amount of fat and protein that supports overall physical health and physical development and neurological development. It also provides a source of iron that is more easily absorbed in the body than formula. It also provides resistance against many diseases and is more readily digested by infants. The American Academy of Pediatrics does recommend that an infant is breastfed for the first 6 months exclusively, and then they receive some form of breast milk for the first year of life. So in this chart, you can see the benefits and some of the concerns with both breastfeeding or bottle feeding. And when we say bottle feeding, what we're referring to is formula. A baby could be fed breast milk through a bottle if the mother pumps, but when we say bottle, what we're referring to is formula. And there are numerous reasons why a baby might be formula fed. Some of those reasons include maybe the mother is going back to work, or there are physical issues regarding being able to breastfeed. If mom is taking any sort of medication, or if mom has any type of infection or virus, then she may not elect to breastfeed. Also, it's a choice. So if a mother does not want to breastfeed, that might be another reason. There are definitely pros and cons to both breastfeeding and formula feeding. And ultimately, as long as that infant is nourished and fed and taken care of, they will be healthy. Children in developing countries and countries that are experiencing harsh conditions of war are definitely at risk for malnutrition. And there's 2 types of infant malnutrition that we'll talk about today. Marasmus is one type of infantile malnutrition, and marasmus is starvation due to lack of calories and protein. And what happens, unfortunately, with infants that are malnourished due to marasmus is they lose fat and they lose muscle, and eventually their bodies, they can't function. Another type is called kwashiorkor, and this is more of particularly a protein deficiency. What happens is that the abdomen begins to swell in these infants and these children, and their body starts to break down the vital organs, trying to use them as some source of protein. And while these types of malnutrition are more common in underdeveloped countries, about 9 million children in the United States are malnourished. One of the main reasons has to do with a milk anemia issue. If a child or an infant is consuming too much milk, this could lead to a lack of iron, because what happens is with too much milk, the calcium starts to interfere with iron absorption and can cause quite an issue for the infant or the child. Most kids do steadily gain weight and grow quickly within the first few years of life. But in some cases, some kids do not meet these expected standards of growth. And when this happens, it's called failure to thrive. Doctors will say that children fail to thrive when they don't gain weight as expected. And often these kids also have poor linear growth, which is how long they are. Many things can cause failure to thrive, including illnesses and eating problems. And once a doctor can find the cause of the problem, they can work with the families to help to get the children back to a healthy growth pattern. Although it's been recognized for a very long time, more than a century, failure to thrive does lack a clear definition, in part because it's not a disease or a disorder itself. Rather, it is a sign that a child is undernourished. And in general, kids who fail to thrive do not receive or cannot take in, keep, or use the calories that would help them grow and to gain enough weight. Doctors usually diagnose the condition in infants and toddlers, which, as we've been talking about, is a very important time of physical and cognitive development. After birth, a child's brain grows as much in the first year as it will grow for the rest of their life, as I mentioned before when we were talking about brain development. Poor nutrition during this period can have lasting harmful effects on brain development. Most babies, as I mentioned, will double their birth weight by 4 months and triple it by age 1, but kids who fail to thrive usually do not meet those milestones. Sometimes a child who starts out plump and seems to be growing well may gain less weight later. After a while, height growth may slow as well. And if this condition continues, undernourished kids might start to lose interest in their surroundings. They may start avoiding eye contact or start becoming very fussy. They may not reach developmental milestones like sitting up, walking, and talking at the usual age. And a number of things can cause failure to thrive. Sometimes it has to do with not enough food being offered, or the child eats too little. There are health problems involved with children's digestive system that could be causing failure to thrive. Things such as a gastroesophageal reflux or GER, chronic diarrhea, cystic fibrosis, chronic liver disease, celiac disease. All of these health problems that involve the digestive system could be also the underlying cause of failure to thrive. If a child has a food intolerance, which is very different from a food allergy, the body might be very sensitive to certain foods. For example, a milk protein intolerance means that the body can't absorb foods that have milk proteins, and that could lead to failure to thrive. An ongoing illness or a disorder, infections, metabolic disorders, these are all things that could cause failure to thrive. And other times, doctors may not be exactly sure what is causing the problem. There is something called non-organic failure to thrive, and this is a type of failure to thrive that does not have an underlying medical cause, but is due to an infant not being held, nurtured, If the parent is just giving bare minimum care to the child, this could actually cause the condition as well. In terms of the diagnosis, many babies go through brief periods where their weight gain levels out, or they may even lose a little weight. That's not unusual. However, if a baby does gain weight for 3 months in a row during that first year of life, if it doesn't gain weight for 3 months in a row during that first few years of life, then a doctor usually becomes concerned. And doctors will use those standard growth charts to plot their weight, their length, their head circumference, and they measure these during the child's well exams, which are quite frequent in infancy. A child may have failure to thrive if they fall below a certain weight range for their age, or they fail to gain weight at the expected rate. In terms of treatment for kids who have failure to thrive involves making sure that they get enough calories needed to grow and to address any underlying feeding issues. And this often requires the help of a care team that may include the primary care pediatrician, a registered dietitian, occupational therapists, speech therapists, social workers, psychologists, or any other mental health professionals, whatever is needed for the child. Usually kids who have failure to thrive can be treated at home along with regular doctor visits. But in cases of severe failure to thrive, a child who is not growing with initial treatment may need tube feedings. Children with extreme failure to thrive may also need to be treated in a hospital where they can be fed and monitored around the clock until they gain weight. In regards to sleep in infancy, it may appear that infants sleep a lot, and they should. Unfortunately, newborns, they do not have a sense of day and night. So they have to learn to be able to know what their days and nights are. They wake very often. Their little tiny bellies typically cannot hold sufficient milk or formula, so they wake often for feedings. But typically an infant should, especially a newborn, should be getting approximately 14 to 17 hours over a 24-hour period. So yes, infants do sleep a lot, and they should, because it's very important, especially that REM sleep, rapid eye movement sleep. During this stage of sleep, infants' brains are developing, and they are solidifying or consolidating the experiences and the sensory stimulations that they have experienced throughout the day. So sleep is very, very important for numerous reasons, but in particular for brain development. There are recommendations in terms of infant sleep. It's recommended that infants be put on their backs to sleep, that they be put on a firm surface, that there isn't anything in the crib or the bassinet, and that when you're putting an infant to sleep, that you dress them for the room temperature and don't overdress them. And all of these considerations are important because it is believed that they will reduce the risk of a syndrome called sudden infant death syndrome. So we're going to watch this video to learn a little bit more about this.
Sudden infant death syndrome, or SIDS, which is also known as cot death or crib death, is the sudden and unexplainable death of an infant during their first year of life. Because of the seemingly random nature of this condition, there are a number of risk factors that seem to correlate with getting SIDS, but there's no clear mechanism or cause that's been identified. SIDS is considered a diagnosis of exclusion, meaning all other causes have to be ruled out before an infant death is given that label. The most well-known risk factors have to do with how an infant sleeps. To lower the risk of SIDS, the recommendation is to make sure that babies sleep alone in a crib, on their backs, and without blankets. The risk of SIDS is higher among boys rather than girls, as well as infants between 2 and 4 months old, and among formula-fed babies. and those born prematurely or with low birth weight. Risk factors that relate to a mother include receiving little or no prenatal care, being a teenage mother, and smoking during the pregnancy. Alcohol consumption is also thought to be a risk factor because there are more cases of SIDS during weekends, the New Year, and other times of the year when drinking is included in celebrations. The fact that far more boys die of SIDS than girls shows that there is a level of genetic susceptibility at play, but the exact specifics are unclear. A minority of SIDS-related deaths show a correlation with genetically inherited channelopathies, which are defects in ion channels that affect a variety of tissues, including the heart. Another possible genetic link is the higher incidence of SIDS in babies with gene mutations involved in the autonomic nervous system. These clues, though, are still being researched, and no exact gene or combination of genetic defects has been identified. SIDS is generally thought to happen in children that have a genetic susceptibility which is then triggered by external factors. An epidemiologic clue is that Native American infants have the highest rates of SIDS, while Asian infants have the lowest rates of SIDS. Cultural practices around sleep, though, might also play a role, and so it makes it hard to tease apart genetic and environmental factors when it comes to race. A diagnosis of SIDS can only be made following an autopsy, to make sure that there isn't an alternative explanation for an infant's death. For prevention, unfortunately, because the underlying cause of SIDS is usually unknown, there's no surefire way to prevent it. Alright, as a quick recap, sudden infant death syndrome, or SIDS, is a diagnosis of exclusion given to an infant that dies of unknown causes, and is most common in infant boys between 2 and 4 months of age, but can happen any time in the first year of life. To minimize the risk of SIDS, infants should be put to sleep on their back, should not be exposed to cigarette smoke, and should be breastfed if possible.
In addition to the information that we just heard from the video, research has looked at the role of the brainstem in SIDS. And again, only through autopsy where a definitive cause of death can be determined. Babies that have died from SIDS appear to have lower levels of a neurotransmitter called serotonin. And serotonin plays a role in sleep, amongst other things. In addition, there appears to be an abnormality in the structure called the medulla in the brainstem. And the medulla is responsible for heartbeat, breathing, and various reflexes, including sucking. So the abnormalities are in the medulla and in the neurotransmitter serotonin. Another recommendation is that if possible, if a child will take a pacifier, to give the child a pacifier while they're sleeping. As a child has a pacifier in their mouth, it stimulates the sucking reflex, and that keeps the structure in the brain, the medulla, more stimulated or alert. So now we'll discuss cognitive development in infancy. Jean Piaget is a cognitive psychologist who we learned about in an earlier unit, who developed a stage theory of cognitive development. He believed that as our brains develop physically, we become more capable of more complex cognitive function. So he created 4 stages of cognitive development. He based his theory on the concept that we develop schemas or mental representations of things through 2 processes of assimilation and accommodation. He believed that when we are faced with new objects or new ideas, we first attempt to assimilate that information into our existing schemas. If that doesn't work or the result is not desired, he believed that we accommodate and we change our existing schemas to fit this new object, to fit this new idea, and we end up developing new schemas. For example, a child who is learning through their senses and through their motor movements may put anything in their mouths. Infants do this all the time because they reflexively suck objects initially in infancy, and there is a reward, there is reinforcement for that. And so they have built a schema, and usually that works for them through assimilation. They first attempt to take any object and put it to their mouths and suck on it. However, this doesn't always work. And so Piaget would say that infants start accommodating, and that's how they learn, and that's how they grow, and that's how cognitive development takes place. They realize that sucking on that rattle doesn't have the same effect as sucking on a bottle. So he believed this is how we grow and develop in terms of cognitive development. And the stage that infants are in is called the sensory motor stage. So he believed that infant intelligence is driven by a child's senses and through their motor movements. Infants will taste, feel, push, hear, and move in order to experience the world. One of the major accomplishments that he believed children achieve during the sensory motor stage is called object permanence. And object permanence is the idea that an object continues to exist even when it's out of sight. Piaget believed that infants do not develop this until they're about 8 months old. However, we're seeing the evidence of this task before 8 months old. So Piaget may have underestimated infant capabilities and cognitive abilities. Piaget broke down the sensory motor period of development into 6 substages. And again, he was a stage theorist who believed that we go through certain stages at certain ages, so his 6 substages also are age-related. The first stage is called simple reflexes, and this stage starts at birth and goes to the first month of life. And during this stage, infants are coordinating sensations, and they're really just acting reflexively, those automatic movements. So their behaviors, for example, as I mentioned, the sucking reflex, they're just basically sucking on anything. If someone's hand was near their mouth, the first thing that they would do is their tongue would come out and they would maybe attempt to suck that hand. However, through 1 to 4 months of age, they start engaging in what we call primary circular reactions. And this is the coordination of sensations, habits. The body is still the main focus of infants, but at this point, reflexes are replaced with more voluntary movements. And they are called circular reactions because they are repetitive, but they do at this point involve the infant's body. So an infant may repeat an action over and over, but usually the focus is their body. So they may, reflexively their hand may go in front of their face, and then they may keep putting their hand in front of their face. So that repetitive action. The next substage is called secondary circular reactions, and usually they achieve this by 4 to 8 months of age. And again, you see those circular reactions. So we're still seeing that repetition, that repeated motion, but now it starts to involve the external environment and other objects outside of the infant body. So an infant may start playing with under a play mat and hit other objects, or a mobile hanging above them. The next stage is the next substage is coordination of secondary circular reactions. And here is where Piaget believed that infants achieve object permanence. Again, though it's believed that he underestimated this ability and that it actually happens a bit sooner. But this substage is more goal-directed, and infants will really be engaging in intentional acts. So maybe a toy that rolled under the couch, that infant may now start looking for that toy. The next substage is tertiary circular reactions, and this is from 12 to 18 months. Infants are intrigued by the properties of and the things that are done with objects, and they really are experimenting. They are engaging in trial and error. And the next stage is internalization of schemas. And so this is 18 to 24 months, the end of infancy. And what differentiates this from the tertiary circular reactions is that now infants are, and toddlers really there now, are engaging in more mental strategies, the mental trial and error of things. So we're really seeing a marked change in their cognitive development, and they are using more sophisticated skills in terms of cognitive development. Language development is another area where we see such a dramatic increase and growth during the infant period of development. Infants do communicate. They communicate pre-linguistically. So they communicate through body posture, they communicate through facial expressions, and also through a variety of vocalizations that they will engage in and make before they actually develop language. And all of these attempts are actually practice for actual language. So you can see from birth to the first month, they communicate through crying. In the second month, they're cooing, and those are those ooh, ahs, those long, extended vowel sounds. By 6 to 9 months, or sometimes even a little earlier, they will start babbling, where they just are repeating things like ba, 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 ma, 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 ma. And by 10 to 12 months, you'll start to see that babbling take on the form of echolalia and intonation, where they may rise in pitch and they may say ma 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 ba 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 ba, something like that. First words are typically heard between 12 and 13 months of age. They are increasing in their ability to use language. They start to develop sentences. They engage in what we call telegraphic speech, which includes holophrases, which are single words that are used to express complex meaning. So they might say mama, but the way they say it could express many different things. For example, they could say, mama, and have a big smile on their face. And you know, they're very excited to see mama, or mama with their hands up in the air. And you know, they want to be picked up. Or they might say, mama, and they're very sad and they have a frown. So those holophrases can express a lot of meaning. By the time they reach 18 to 24 months of age, they start using two-word sentences, which shows that they are understanding syntax and the use of words and language and giving them meaning. They also engage in a variety of different styles and uses of language. Some use underextension, where a word can only be used for that object. So if a child has a pet at home, maybe a cat, and they call it kitty, they would only call their kitty kitty. So if they see other cats elsewhere, they'll say, that's not kitty. I don't know if they'll say all of that, but they might just say, no kitty, because they think that kitty is the word for their cat. More common is overextension, and this is where they overuse or overgeneralize a word. So in this case, they might think that all animals are kitties instead. They also they will use referential styles, which is basically having a name for a word, so they know like kitty, they know dog, they might know juice or milk. These are just the names of objects or things or people. Expressive style has more to do with describing things, and this takes a little bit longer to develop, but with gestures and other things, they can express a lot more, but they will understand more than they can express at this time. There have been a lot of theories about how language develops, and in the past, the two theories that really competed were the learning theory approach and the nativist approach. The learning theory approach was really originated by B.F. Skinner, the behaviorist that we've talked about in the past, and he believed that we learn language through reinforcement. When babies say a word or they coo, pre-linguistically, if they see smiling faces and they get that encouragement, they'll do it again. And the more that we give them that positive reinforcement, the more that they will do it. Noam Chomsky, on the other hand, took a nativist approach, and he believed that we are all born with the capacity for language, and that's how we'll learn language. He called this neurological device or construct the LAD, the language acquisition device. And he believed that having the neurological structure actually is what makes infants and children ready for language. Now it's believed that both the learning theory and the nativist approach, a combination of the two called the interactionist approach, can help to explain language development best. That yes, there needs to be that neurological construct, those areas of the brain that help us to understand and express language have to be intact. But we also need that learning, and we need to hear language, and we need to be reinforced for language to be able for it to develop properly. So we're going to talk about in class a particular case study called Genie, and how this really shook the linguistic community, and how she really proved a lot of theories wrong, unfortunately, because of the harsh circumstances in which she was raised.